everyone is taking a deep breath from the drop kick that COVID gave all of us in the last 2 years.
Yeah, we're still taking that in.
Yeah, I can only imagine. I can only imagine. It's been, I think, from a supply chain standpoint, it's we've taken off the proactivity hat, and we're so reactive because the headwinds are changing so quickly and so broadly that it's actually making us now start looking at a 5-year horizon now and start planning. I mean, I think the horizon we're looking at pretty much annual. We're looking at 2 years. Now we're looking at 5 years, and the possibilities. What can go wrong is what we're looking at right now.
Yeah, interesting. That's the question Azuka actually asked. She wanted to understand, what kind of data are you gathering, and what does that inform you about forecasting for the business? And rightly said, that's
so I mean, and that's
Azuka's back. Let me let her.
Okay, hi Azuka. Sorry, the question again.
Africa and power surge. I just got caught up. That's the reality of Africa. So looking at my situation where I just got caught up, how is Mpharma dealing with this, our continent, and how are you doing it in this country using your technology, ICT, to make sure across the supply chain you are able to deliver efficiently? And like I mentioned earlier, sorry about that, I was cut off. Looking at it today, but also looking at the opportunities within the free trade area. How are you looking? Thank you.
Well, I mean, thank you for that, Azuka. So one of the things we've done in Mpharma is pretty much focus our investments on ICT, actually building out our product and engineering teams. To that end, the conduit that we use for collection of data is through our proprietary software called Bloom. So Bloom acts like a POS system, also aids in our inventory management, from our inventory management also to collection of patient data and statistics across markets in sub-Saharan Africa. So we've created a platform that is easily integrates to our ERP systems. We use SAP primarily, and we use this pretty much anywhere from our sales operations all the way to data collection. Now, how does this guide us? I will take you into from private practice to public space, because right now we've moved into one of the recent collaborations we've had is with the government of Gabon to transform their central medicine stores. What you find, especially in that space, is that there's absolutely no data. When we got in there, we could not tell what the last patient at a certain hospital in Oyem or Kojontel took in the last month. So we had to pretty much build everything from scratch. So that is why, I mean, that's, that was pretty much our value proposition to them. First of all, we need data to be able to determine what the disease outcomes are, what the disease prevalence, patient behaviors, and this would help guide our procurement of molecules, what particular molecules we procure from where. Because again, when you're dealing with sub-Saharan Africa, you have to look at not only the product efficacy, but the thermostability data of the molecules you bring in to ensure, of course, you are able to store enough inventory based on the shelf life. Because for imports coming to sub-Saharan Africa, I mean, from manufacturer to landing at the ports, you've lost close to 25% of available shelf life already. So you have to find a way to maximize it. So we're looking at products that primarily would treat the particular disease and also enable the government or the private sector company like all ours to avoid expiries, etc. So from a data standpoint, it starts from our proprietary POS system, which is Bloom, and we use that to collect data. From a forecasting standpoint, this helps us determine how the patient behaviors, as I said, and also we're able to get data on disease prevalence. So we know where we get the spikes in what particular period from a seasonality standpoint, where malaria climbs, where we have a spike in cases of HIV, etc., especially based on our dispensation data. So we're able to actually track this. Now it varies across countries. I mean, in Nigeria and Ghana, you see different swings. For example, one of our vaccines, one of our treatments that we use for snake bites is looking at how, when we do our heat mapping, is bright red, especially in the rainy season in the north of Ghana. I never knew that until I started seeing the data, right? So this is how we engage the manufacturers as to what we need to buy, where we need to buy it, where the right products need to be in what particular country. So that is, I mean, just a general answer to that. So, I mean, thank you for that, Azuka. I mean, this is one of the areas I've been passionate about on data, access to data. My quick answer is the government and the regulatory bodies. Why do I say this? One of the main issues, especially we've had with the regulatory bodies, especially in Nigeria, is that they lack access to patient data, to efficacy data of the drugs. They are still very, very archaic in how they look at approvals of molecules via how you put together dossiers. For example, in Nigeria, it takes close to 6 months to get approvals for a single molecule, as opposed to Ghana, that can be done in under a month. And it's simply because of the very archaic process of putting together volumes and volumes of dossiers that really could be harmonized into a few pages. But because they don't have the data, I'll give a good example. When we, at the beginning of the pandemic, we were the first company to actually bring in testing equipment, test kits, reagents, etc., into Nigeria. And I had to literally use personal relationships to get the approval done in 3.5 months. This was from the Director General of NAFDAC directly. Without her, it would probably have taken 7 months. Now you are looking at a pandemic. You would think that there's going to be an urgency in approval, that this would be done in a few days, actually in a week, considering the urgency of the particular situation. But they didn't have the data. They didn't have access to the data from the FDA, who have actually approved the test kits, etc. The test kits were actually used in other countries. Data on the particular on the false positivity rate was actually published, but they did not have access to this data. The second point is, when I look at anti-counterfeiting strategies in some of these countries, I will use Nigeria as an example because I helped pioneer the SMS authentication initiative we have in Nigeria now with GSK. We don't have, for example, we know based on the data we've received from some of the pharmaceutical companies, what ports have the highest inflows of counterfeits, what particular states, what markets have, if you're going to do a heat map of the prevalence of counterfeits, particular distributors, entry points, we have all this information, but the government doesn't have it. So it limits their enforcement capability. And if all the pharma companies in Nigeria were actually shared this information, not only pharmaceuticals, but other commodities from tobacco all the way to pharmaceuticals, share this information, it can help target enforcement to these particular areas, and of course, to optimize the use of their resources, because they're limited. So yeah, in summary, it's pretty much at the government and the regulatory bodies.
And the regulatory. Do you agree with?
I think it should be the focus of the AU right now. Their purpose should not just be conflict management. I think they have been too bogged down and too focused on the wrong things right now. And a lot of, if you think about the economic, the reasons for a lot of the conflict management that they have to deal with, as a result of economic economic issues. If we're looking at local manufacturing and we're bringing everything in-house, like Dr. Taka said, and we are actually harnessing the power of a collective Africa, they won't have as much time to focus on conflict management. They will be more concerned as to how to continue to grow the continent. But again, it's the governments we have. I'm not sure they are thinking really outside the box. And I think you mentioned something about Africa Development Bank, Azuka, is also one of the frustrations we've had. I think I've had some conversations with them on funding local manufacturing initiatives, especially on out-of-patent molecules. Even with I've given them proposals on manufacturing with the right certifications that we can get the manpower in place, and they're not interested.
Yeah.
So